Over the past decade, the number of people undergoing spine surgery in the United States has been constantly increasing. An aging population of baby boomers and advances in medical and surgical techniques has led to increased patient demand. Chronic back and neck pain can be overwhelming. But is surgery always your best option? Here with us to talk about that is medical malpractice attorney Paul DeMore from DeMore Personal Law and Jennifer Balducci of One Physical Therapy. Thank you guys so much for joining us.
Thank you
Thanks for having us.
So people are going to be watching and saying, Paul, why are we talking about this today?
You know, as a medical malpractice attorney, I get a lot of phone calls from people who've undergone spine surgery and are worse off than they were before they had the surgery.
Really?
Broken hardware, infections, failure to alleviate pain, even paralysis can be the result of a spine surgery gone wrong.
So they've done all this in hopes that they would get some sort of alleviation from that pain, and then they're worse off.
And they just haven't. Now, sometimes I can prove that those are because of those outcomes are because of medical negligence, but would have really helped those people in a lot of cases if they hadn't undergone spine surgery at all. So I asked Jen to come. She's a physical therapist who specializes in pain management and chronic pain treatment. And I've asked her to come and talk to your audience a little bit about how we might be able to have some of these people avoid back surgery.
Avoid that surgery?
Yeah, and what exactly to speak what Paul was saying is that what most people don't realize is that about 50% of back or neck surgeries don't have the outcomes that you would expect. So they actually...
Sorry, repeat that. About 50%?
So about 50% actually aren't successful in the way that you would want. They don't reduce the pain. They're not really helping the way people would want them to.
Got it.
And out of those 50% that have a positive outcome, in 5 years, a vast majority have return of symptoms that they originally had. And that's because people don't make the lifestyle changes that they need to really make improvements in their pain.
You know, it's funny as you're, well, not funny, but as you're saying this is hitting home because I have a family member, extended family member, where he's gone through several back surgeries. Correct. And we're thinking like, this is going to be the one that fixes it.
Yeah, and actually your odds are worse, and Paul can probably attest to that with each continuous back surgery that you have, things actually are, your outcomes are worse.
But there's a way that people can get in front of it. So show us a little bit about what it is that you do.
So I'm a physical therapist and I specialize in the treatment of back and neck pain. McKenzie therapy is a type of certification that I have, mckenzie.org, you can look that up. And I've been a physical therapist for over 20 years, working with a lot of people with back and neck pain. And what I really hope that people take home from this is that if you work with a good physical therapist, and again, not all physical therapists are created equal, you have to vet them out just like anything. So if one isn't working for you, go to see somebody else.
Same thing with lawyers.
Exactly.
Right? Yes. No, we vetted you. That's why you're here. You're good.
But if you find somebody who knows what they're doing, they're going to show you lots of ways that you can treat your pain yourself, get to the root cause of the problem, and fix your symptoms without having to go underneath the knife or, you know, pain medications, since we're having an opioid crisis as well.
Absolutely.
So I brought a few things, a few props. So
now that looks scary to me.
No, this is my favorite thing ever. Also.
Like, I don't know.
So this is called a Theracane, and what's great about it is that it helps you to do almost like self-mobilization or self-massage, and you take the end of it and you actually pull on the areas that are painful, and I'll let you try that.
Hands.
This would be, and you can actually put it
where it hurts.
Right where it hurts.
Oh, that's actually not so bad.
And then give it a nice little pull, hold it for about 7 seconds, and it helps to release trigger points. And you can do that anywhere along your spine. Good. Helps to release the tension.
I think I'm enjoying this too much because we only have about 30 more seconds, so I want us just to talk about this real quick.
A couple other things. So point stimulators are great. You might have a physical therapist that can use this, and kind of it makes a funny buzzing noise, and it can go on different areas and treat areas of pain.
Okay.
And it helps to reduce the pain. And there's also something called kinesio tape, which can help.
I've had that too.
Olympic athletes use it all the time. And you put that on, again, helping to reduce the muscle spasms.
Thank you both so much. This is actually very, very helpful information. Always, if you want to learn more, you can visit our Serious Injury Resource Center at DeMoreInjuryLaw.com. Stay with us. We'll be right back with more Midday Maryland right after the break.